we are going to present the implementation and use of chlorpromazine in the control and treatment of human paranoid schizophrenia. The objective is try about implementation and use of chlorpromazine to control schizophrenia in the human beings. To this, it is necessary to know about schizophrenia. Schizophrenia is a mental disorder which is characterized to present delusions like sight, auditory, and visual. Also, schizophrenia has the following classification. There are 5 categories of schizophrenia. For example, paranoid, catatonic, disorganized, indifference, and residual. The research problem in our case is the schizophrenia and its relation with chlorpromazine. Also, we present the paranoid schizophrenia because this type of the schizophrenia is the most frequent and it is characterized by present delusions like visual and auditory. Also, this issue is a problem that affects more than 21 million people around the world. To solve this problem, there are conventional therapies. For example, combination of medications, psychotherapy, and especially coordinated care service. The chlorpromazine also is known like largactil or thorazine because these names are recognized in the commercial reference and the commercial industries. Well, our research question is the following: how to treat and control the paranoid schizophrenia through the use of chlorpromazine? To this, we use the National Library of Medicine, in this case online, to obtain information. Also, chlorpromazine can be found in different words, journals, and papers in this page. In this case, we can see the following table. In this table, we have different years in which schizophrenia was treated with chlorpromazine. For example, in 1950, Charpentier released the synthesis of the chlorpromazine. In 1951, Silvat and Bowter released the first treatment with chlorpromazine. In 1952, Heyman relates the first publication about efficiency of chlorpromazine, and in the 1952, Delay and Daniker relates the first valoration, in this case systematic, about chlorpromazine. These years are relevant because these years were the milestones like the revolutionary path and milestones in the medical and clinical field related with how to treat and control the schizophrenia with chlorpromazine. Also, we have the most relevant scientific, in this case, Henry Laboret, who worked with chlorpromazine in the medical practice. Also, chlorpromazine was treated and analyzed in laboratory of physiology by the proper Henry Laboret. With that was possible introduce and implement the chlorpromazine in the medical and clinical field. Also, like implementation, in this case related with chlorpromazine, chlorpromazine was and is the most relevant drug, was implemented to treat and control the paranoid schizophrenia in some countries around the world in present. Also, the World Health Organization recognized that chlorpromazine as one of 5 medicines used in psychotic disorders like schizophrenia. Also, we have the following example. In the University of Navarra, especially and specific in the clinic University of Navarra, Spain, there are therapies and treatment of the schizophrenia in the affected people, presenting exceptional results in use of chlorpromazine in the clinical field.
The first use of chlorpromazine in psychiatry was made by Henry Laborit in 1852. Chlorpromazine was used as a complement to surgical anesthetics due to its reducing effect on body temperature. This same year, chlorpromazine could be prescribed in France, and within the next 3 to 5 years, it was being used as a treatment in different countries around the world. In 1869, it was determined that chlorpromazine must be administered in adequate doses to achieve an effect in the treatment, being at least 500 milligrams per day, necessary for the therapeutic effect to be given. In 2013, a comparative study of chlorpromazine and other antipsychotics was carried out. Also, the results showed that chlorpromazine was more effective than other drugs, such as lorazepam and iloperidone, and it also obtained the same effect as ciprasidone and azenapine, but not as good as haloperidol, quetiapine, and aripiprazole. Nowadays, chlorpromazine can be dosed by a specialist through an appropriate dosage. Nevertheless, chlorpromazine as a treatment for schizophrenia helps control symptoms. However, it does not cure the condition. Therefore, people who use this medicine should keep taking this even if they feel fine, because if they stop taking this medicine, they could experience unwelcome symptoms. Also, there are some secondary disadvantages for the use of chlorpromazine, like pain of head. It is considered to reduce the action of receptors at the brain level and inhibits the release of hypothalamic hormones, which favors the nervous systems. As a consequence, the treatment with medication and psychosocial therapy can help control the disease. In some cases, a hospital stay may be necessary. Treatment is usually guided by a psychiatrist with experience in schizophrenia. Medication are the mainstay of schizophrenia treatment, and antipsychotics are the most commonly prescribed. In this case, the use of chlorpromazine. The psychiatrist may try different medication, different doses, or combination over time to achieve the desired result and control this issue. The control over this issue can appear in several weeks to see improvement in symptoms. Chlorpromazine is a medicine that works by blocking dopamine receptors in the brain. Dopamine participates in the transmission of impulses between brain cells. When an excess of dopamine is produced in the brain, receptors are overstimulated, which act by modifying behavior. Chlorpromazine blocks the receptors and prevents overstimulation, thus helping to control mental illness.
We conclude, based on the current evidence, that the use of chlorpromazine is associated with a reduction in the incidence of the effects of the schizophrenia. Also, chlorpromazine is a drug that is proven valuable in treating mental disorders. It has various pharmacological actions in the human organism and implies an improvement in the affected people, in this case, people with schizophrenia. Thank you.